Well, hello, everybody. My name is Corinde. I have been an assistant professor at Penn for the past 3 years. And before that, I was a postdoctoral fellow at NIH in Bethesda, Maryland. So I'm today is presenting on some experiments we've done on ketones and alcohol in the past few years. And I think Hank has already presented on alcohol use disorder. But overall, worldwide, 3 million deaths occur every year as a result from harmful alcohol use. And apparently over 1 in 7 Americans are estimated to develop an alcohol use disorder in their life. And with COVID, it was really a bit of a balance. Some people really dramatically increased their alcohol use, whereas some people just, lived a better, more healthy life and really decreased their alcohol intake. But overall, there's an urgent need for interventions that can promote long-term abstinence and reduce alcohol craving and alcohol withdrawal during treatment. So today, I will first start about talking about altered brain energetics that we see in individuals with an alcohol use disorder. And I present some studies that we've done on the ketogenic diets and on ketone supplement drinks, on alcohol withdrawal, alcohol consumption, and also recently with Cindy on alcohol metabolism. And then all the way at the end, talk a little bit about alcoholic ketoacidosis. For years, actually, it's been found that if you drink alcohol acutely, when you're laying in a PET scanner and you measure brain glucose metabolism, that alcohol reduces the utilization of glucose in the brain. And first this was interpreted as, oh, look how terrible, the brain doesn't function well when you drink alcohol, and that made this whole decrease of glucose or sugar in the brain may be the reason of cognitive deficits after drinking a lot, or people feeling drowsy, etc. But then it's 10 years ago now, Nora Volkov, my previous mentor at NIH, did a study where in parallel she also measured the metabolism of acetate in the brain. And acetate is a metabolite of alcohol. So if you drink alcohol, it gets absorbed in the bloodstream and it gets metabolized by the liver and oxidized into acetate. And acetate can cross the blood-brain barrier and can be used by the brain as an alternative energy source than glucose. So she found that, okay, when you drink alcohol, sugar metabolism may be down, but actually acetate metabolism goes up. So there seems to be a shift in the primary energy source in the brain when you drink alcohol from glucose to acetate. And also some studies have shown that during sobriety, individuals who drink a lot or heavy drinkers or individuals with alcohol use disorder, that even when they're not intoxicated, that they tend to have higher levels of acetate in their brain, and most definitely, and this has been replicated many times, lower levels of sugar or glucose utilization in the brain. So even if alcohol is not there, acetate still somehow remains an energy source, and glucose utilization seems to be impaired in the individuals who drink heavily. And we thought, well, this may actually be relevant for alcohol use disorder treatment, because when people come into an inpatient unit and detox or quit drinking for other reasons, this decrease in alcohol and this acetate may actually result in an energy deficient state in the brain. Namely, the brain was functioning on high acetate, and that throughout a detoxification plan needs to get reduced again to low acetate, and the low glucose may slowly come back to high glucose. And what we hypothesize that this may actually contribute to withdrawal symptoms like this urge, or alcohol craving and relapse in alcohol use disorder. So this urge to drink again, maybe just to supply acetate again in the brain. And a ketogenic diet, you may sometimes see it in more like health magazines. It's a diet that's very high in fat and low in carbohydrates, and it's frequently used for the reduction of seizures in people with epilepsy. And it leads to this bodily state called ketosis, namely cells in the body, including neurons, are using ketone bodies for fuel rather than glucose. And these ketone bodies are acetoacetate, beta-hydroxybutyrate, and acetone. And primarily acetoacetate is very, very similar structurally to acetate. And below you see what a ketogenic diet may look like. It's extremely high in fat, very low in carbs, and reasonably okay-ish in protein. But it's very, very difficult to stick to. I tried to do it for a few days, and it's so difficult to not eat carbs.
So it's like an Atkins diet.
So the Atkins diet is the most extreme, or the conventional ketogenic diet is of 4 grams of fat to 1 gram of carbs and protein combined. And an Atkins diet is a 1-to-1. So it's even 4 times more extreme than an Atkins diet. But an Atkins diet does also increase ketone bodies to a certain extent. So overall, the question that we ask in my lab is, could these ketones actually help overcome the hypothesized energy deficient state that we see in people with alcohol use disorder? So can ketones replace acetate in the brain as a main energy source? And this is already 5 years ago that our collaborator Anders Fink Jensen found in an animal study that when he treated rats with a ketogenic diet compared to a regular carbohydrate-rich diet, that during alcohol detoxification, or just alcohol withdrawal, immediate alcohol withdrawal, that those rats who received the keto diet, reduce their body rigidity and irritability, which apparently in animals is a sign of alcohol withdrawal. So that was an interesting first study on this. And at NIH, we did a 3-week ketogenic diet trial in an inpatient unit. So we randomized people who came in, often very drunk, very intoxicated, into the unit and were there for a 3-week treatment, detoxification treatment. And we randomized them into receiving a ketogenic diet or a control standard American diet. So it's like 50% of carbs or so. When they came in, and in the end, we had a final end of 19 people who received the 3-week ketogenic diet and 14 who received the standard American diet. And what was most important to me was that it was blinded. It's very difficult to blind a nutrition study, but it was actually possible here by giving people a largely liquid diet. So people received a shake for breakfast, lunch, and dinner that either had high fat in it or not that much fat. And yeah, we didn't know and they didn't know. The nutritional department developed them and weighed every day how much everybody drank. And on the side, people received some more ketogenic snacks like eggs or salad or so. Because they complained in the beginning that they really needed something to chew on, which we understood, so we added that. But yeah, below in the graphs, every morning an independent person analyzed the urine sample, and you see that those who received the ketogenic diet, the urinary acetoacetate went up gradually, whereas the control diet group had basically no ketones in their urine. And also in blood, you see that the ketone levels increased in the ketone group, but not in the control group. And there was a small dip actually in week 3 because there were 2 people who went to a pizza party and couldn't help themselves. So not too nice, right?
That's right. We're going to be doing serum BHB, right?
Well, Cindy is a pro in that, right? With finger sticks. We also, just as a proof of principle, wanted to see if ketones actually cross the blood-brain barrier. And yes, we were able to detect ketones in the brain in the dorsal-anterior cingulate cortex. And after those 3 weeks, we did an end of diet evaluation. And most people actually, after drinking these drinks, thought they received the ketogenic diet. There was no effect, so they did not know what they drank. And overall, we were actually quite pleased by their pleasantness ratings. It's still like averaged around a 6 or so, so it wasn't that unpleasant apparently for 3 weeks to stick to a liquid diet. And there was a small effect, I think, what was it again, that those who expected they were on a standard American or a keto diet, but actually received a sugary drink, they actually liked it better. And there was no effect on, do you think this diet improved your health? But the main finding of this study was that when people undergo alcohol detoxification, they receive benzodiazepines to reduce their withdrawal symptoms. That those individuals who received a ketogenic diet had a reduction in their benzodiazepine intake. And this was all where the benzodiazepines were provided by a psychiatrist who also did not know what the diet was people received. So there seemed to have been a clinical effect in reducing withdrawal, namely those who needed medications, or there were just fewer in the KD groups. Oh yeah, so the number of people also who needed medication after diet initiation was lower in the ketogenic diet group compared to the standard American control group. And every week we did a functional MRI scan. I think Jen Hao, she may have talked about fMRI, alcohol, or no, opiate cue reactivity. But we basically presented people in an MRI scanner with pictures of food and of alcohol and just of neutral cues such as a lamp, and looked at their brain activation. And we analyzed it in a way. It was a really interesting paper that came out earlier this year by Heidi Kober et al. That basically took functional MRI studies from hundreds of people and really looked at, okay, which brain areas are more active in people who are within drug users compared to non-users when they look at drug cues. And those brain areas, primarily the ventromedial prefrontal cortex, which is about here, and is associated with more wanting and liking certain cues, was active in the drug users compared to the control users. And we found that just when you ask people, do you want alcohol when you see these cues, there was a small reduction over time in the ketogenic diet group for alcohol cues. And also we found a reduction in this neurobiological craving signature in the ketogenic diet group compared to the control diet group.
I have a question.
Yeah, please.
So you might have mentioned this, but are you like, was it a finding that the ketogenic diet like made their energy levels higher and therefore lowered their craving?
No. So we did a lot of questionnaires every day, before breakfast, after breakfast, before dinner, after dinner. We asked a lot about energy levels, about mood, about how much do you crave, other food, etc. right now. And there was really no effect on any of that. So it may be because we had such a low number from 19 versus 14. We wanted to have like 50 people, but then we had to stop when the COVID pandemic hit, which in a way was actually good for me because it was good to just analyze the data and come here rather than continue the study. But yeah, we did not find an effect on energy levels. We also wondered, well, does a ketogenic diet affect alcohol consumption? And here I partnered with somebody from NIDA, Leandro Vendroscolo, who does a lot of animal studies in alcohol use. And they ran a study. Basically, first they taught rats how to self-administer alcohol in a laboratory setting. Then for 2 months, rats received a regular diet or a ketogenic diet. And as you can see also here, the ketone levels went up in the ketogenic diet group. And after that, he divided those regular diet and keto diets into another 2 groups, namely rats who became alcohol or dependent on alcohol versus rats who were just vaping air. So his model for alcohol dependence induction is by vaping. So for 14 hours every day, for how many weeks? 7 weeks, these rats were vaping alcohol in a little box, which apparently makes you quite dependent on alcohol. And after that, he looked those 4 groups, what was the effect on this self-administration of alcohol. And there was a clear effect that those rats who had previously received a keto diet, that they had less or lower alcohol self-administration compared to those alcohol-dependent rats who received a chow. But at the time of testing, they were all on a regular diet. So it was really that the history of a keto diet also reduced alcohol self-administration. And last year, this finding was somehow replicated in alcohol-dependent mice, but here the mice were actively on a keto diet. So when you're actively on a keto diet, apparently, at least in rodents, your intake of alcohol is lower. And what we found also, that was really surprising to us. So the reason that Leandro looked at a history of a ketogenic diet was initially he looked at alcohol self-administration when the rats were on a keto diet, but they couldn't tolerate it at all. Many of them just passed out. Some of them even died because when they were exposed to alcohol while in ketosis, their blood levels of alcohol were about 5 times higher. So this was also the first time, or we've never seen this in the literature, that apparently if you are on a ketogenic diet and you're exposed to alcohol, that you're much more sensitive to it. And Cindy is actually going to study this in humans, but at a much lower dose of alcohol and also shorter duration of a ketogenic diet. And we're still currently trying to find out what is it that actually is responsible for this. So Leandro actually isolated some of the livers of these creatures and found, one of the small findings was that alcohol dehydrogenase, which breaks down alcohol, the enzyme that breaks down alcohol, was downregulated in the K3 group. So maybe that is one of the mechanisms that leads to this. But it may also be related to glycogen storage or something else. I have no idea, but we'll find out one day. So an interim summary, we found for the first time that this KD intervention, it's Cindy when she started. It's very bright.
She was more relaxed.
Exactly.
Yeah.
The ketogenic diet intervention was well tolerated in human inpatients with alcohol use disorder. And we saw that the diet reduced benzodiazepine intake and this neurobiological alcohol craving signature. We also saw in rodents that the diet reduced alcohol consumption and increased alcohol sensitivity. And yeah, like I said, Cindy will soon also try to replicate those latter findings in humans. But as I said, there are many limitations to a keto diet. It's extremely rigid. You're immediately out of ketosis if you eat a bite of pizza. So yeah, very difficult to maintain, and therefore it has low retention rates. So even in people with epilepsy who do really well on a ketogenic, some of them do really well on a ketogenic diet, even their relapse rates, or well, rates of eating chocolate again or pizza are very, very high. So more recently, there were these drinks developed, and my lab, or no, my office looks a little bit like a bar because we have so many of them that we tried out. But there are these ketone supplement energy drinks. So it's basically a ketogenic diet in a bottle. because these drinks, they have BHB or beta hydroxybutyrate or precursors of them in a drink, and they immediately increase ketone levels in the blood within half an hour, and then one dose kind of goes down again over the course of 4 hours. And a few years ago, it was found that if you give this to people, it decreases appetite. And there are many other studies currently ongoing in diabetes and also physical performance, etc., to see if it improves. The physical improvement, I think you sent in the Washington Post article a few weeks ago that actually this drink did not do any good for long endurance sports. But yeah, the levels of ketones in blood are very similar within or after one dose, within 1 hour, compared to BHB levels or ketone levels that we saw after 2 to 3 weeks of this rigid ketogenic diet. So for experiments here at Penn with humans, it's just much easier to give it to them and immediately test effects. And in terms of alcohol withdrawal, 2 years ago, there was a study that came out, again from Denmark, from Anders Fink Jensen's lab, that compared ketone supplements and a ketogenic diet. And he basically saw that both of them are sufficient in...
Graham Mason.
Yeah, Graham Mason is there too.
That's interesting.
So they actually, Graham Mason is, he ran an MRI component in a human study there. You know him
He's a
well.
collaborator of ours at Yale.
Yeah, we talked with RSA 2 weeks ago. But yeah, Leandro repeated this experiment again in rodents. Namely, does this ketone supplement reduce alcohol consumption as well? So for 7 weeks, poor creatures, or well, maybe they actually quite happy. They were vaping alcohol for 14 hours a day. Then they received just a single dose of ketones or a vehicle or just like a placebo. And after that, they were being tested by seeing how much alcohol they self-administered. And it's, yeah, please, I have a question.
So wouldn't it be that like the ketone supplement reduce the alcohol consumption because they are more sensitive to alcohol?
So in the previous study, yes, but that's why we also tested whether a history of a ketogenic diet when the rats were actually on a normal diet again for 6 weeks also had an effect, and it did, but it definitely had a more drastic effect when they were on the diet. Namely, well, it's actually difficult to say because the levels they received, some of them couldn't even self-administer alcohol anymore because they were passed out. But here we just wanted to see, does it reduce alcohol consumption? But we did not check in these rats at least. Or did we, Cindy? Yeah, actually we did. We looked at blood levels of ketones here, and there were actually no differences. So if these rats were exposed to this ketone supplement, there were no differences in blood levels of alcohol, or if anything, they looked a little bit lower in the ketone supplement rats. And they were also the same rat. So the same rat receives the vehicle and the ketone supplement. But yeah, it could definitely be for the ketogenic diet, most definitely it's one of the mechanisms of alcohol sensitivity. For the ketone supplement, we don't really know yet.
Wait, also another question. So I know that some people are like, oh, if you're drunk or something, eat some bread and it's gonna absorb alcohol. So that's why I'm thinking, that's like what my mind went to when you say no carbs, only like high fat. Like, do you think that would have something to do with the absorption of alcohol?
Yes.
When you're in keto versus non?
Yes, so if you
Once you're drunk, it's too late. You've already absorbed a lot of the alcohol.
so that would be for absorption, but still something like glycogen storage. Like I don't know too much of it, but if you've eaten more carbs recently,
Previously, yeah.
yeah,
That's why carb loading before you run a long race, for example, it's an effort to build up the glycogen in your liver so that you can maintain your blood sugar over time. Glycogen is a complex carbohydrate that releases it's a substrate for glycogen, for glucose release into the blood from the liver.
Yeah, so even with the keto diet, it could be that the lack of carbs leads to a faster absorption of alcohol and probably a slower breakdown of alcohol, both of those. But with the ketone supplement, we actually didn't really test it yet. But currently we have a few studies ongoing at Penn where we look at the ketone supplementation on brain energetics using positron emission tomography and magnetic resonance imaging, and primarily look at glucose and ketones. We also look at alcohol sensitivity and alcohol wanting and liking in humans. We are planning to study alcohol withdrawal in an inpatient unit an hour away from here. To test the effects on alcohol.
2 hours.
Is it that far? Maybe we drive a little fast. Cindy. No, we're already in North.
You really? The others are coming.
I don't remember. Hour and a half then. Well, in the first study that we conducted in the last 2 years, we tested the effects of the ketone supplement on brain glucose metabolism. So healthy individuals and individuals with an alcohol use disorder came in twice, once after an overnight fast without any intervention, and once after an overnight fast with this ketone supplement. And we found in bloods that, of course, the ketone supplement increased BHB, and also that the supplement decreased glucose levels in the blood. We still don't fully understand why that's the case, but most likely the ketones somehow increase insulin as well, which is why glucose levels decrease. And in the brain, we also saw a rapid decrease of glucose metabolism or glucose utilization. So throughout the brain, there was an overall reduction of 22%. And this map actually looks very, very similar to when you give people alcohol. So when there's this shift from glucose to acetate, and here there seems to be a shift from glucose to ketones. And we haven't tested ketones with PET yet, which would be great, where you can actually have a map to see, okay.
Test it with what?
With PET, sorry, positron emission tomography. There are tracers out there where you just inject a radioactive tracer to measure the absorption of ketones throughout the brain. And I would definitely expect that there where glucose goes down, ketones go up in brain areas. But we did the next best thing, namely magnetic resonance spectroscopy, and the same dose of ketones increased ketone levels very rapidly in the brain. So those findings are consistent with if you drink these ketone supplements, there's a rapid shift from glucose to ketones as a brain energy source. And the second study we've been doing in the last year, Cindy has led this, namely on the effects of ketone supplementation on alcohol metabolism. And here we tested 10 healthy volunteers who were moderate drinkers. They had to drink at least 2 drinks in the last 30 days on one occasion, so that it was ethically okay for us to give them alcohol. And they came in and received a placebo or a ketone supplement, and then did an alcohol tolerance test or an alcohol challenge, in which they received a moderate dose of alcohol. And then, yeah, so they came in twice, placebo alcohol or ketone supplement alcohol. And to our big surprise, because we first had those data, of course, on the ketogenic diet, that's why we didn't want to go very high in the alcohol that we gave them. But we actually saw the exact opposite. So those individuals who received the ketone supplement had a much lower breath alcohol concentration, blood alcohol concentration, and also their behavioral ratings of liking and wanting more was lower for the ketone supplement.
And feeling was higher.
Not really.
Oh, no?
So this is the
Oh, I see.
need.
Yeah.
But
It's
it may
more
be
disturbing.
It may be because of the low levels of alcohol that we give them, so they can't really distinguish it. So we try to target a 0.05%, but the placebo has a high concentration of glucose, so that's why it was reduced, the concentration of alcohol. So our delta is much lower.
Wait, so they both receive the same amount of alcohol? Like both groups?
Yes. Oh, they're the same group. So people came in twice. Once they received a ketone supplement and once a placebo in a randomized order. I tested on myself in the previous states, and it was really weird if you just drink alcohol after these ketones. I didn't feel it. So most likely what it's doing is that it blocks the absorption of alcohol, but we don't know it yet. And also in rats, we saw the same thing. So yeah, the kinetic somehow blocks the absorption or increases the breakdown of alcohol. And there was allulose, it's a sweetener that is in this ketone supplement. So we wanted to test in animals if that was maybe causing this and not the ketones, but it seemed to be identical to water. But Victoria will present many more details on this experiment next week. And the third study has not started yet, but hopefully soon, on the effects of ketone supplementation and alcohol withdrawal. 1.5 hours to 2 hours away from here in collaboration with the Care and Treatment Center. So another interim summary, these ketone supplements seem to decrease alcohol withdrawal and alcohol consumption in rodent models. And we are now having follow-up studies planned to replicate these findings in humans. And the supplement shifted brain energetics from glucose to ketones as an energy source. And in contrast to the ketogenic diet, the ketone supplement decreased alcohol sensitivity. And overall, ketones may be of therapeutic benefits to individuals with an alcohol use disorder, but we really have to test many, many more things for this. And one of the dangers, and one of also the clinical condition that has been most associated with ketones and alcohol is alcoholic ketoacidosis. I'm not a clinician, so Henk can probably talk more about this, but I don't know if you've seen many patients in an emergency department with alcoholic ketoacidosis. But this is a critical condition in people who drank a lot of alcohol while they were basically not eating well. So they have an elevated anion gap or just poor electrolyte levels and have elevated ketone levels. And their symptoms are that they're vomiting, dehydrated, agitated, and this condition may even lead to sudden death. But it's also quite easily treated apparently with just a dose of dextrose and vitamin B1 to somehow lift again.
B1? I was going to ask that.
Is it because of the NAD or not?
It's because the metabolism of dextrose or glucose, which is the same thing, eats up thiamine in the hexose monophosphate shunt, I believe, and can cause Wernicke's syndrome. Wernicke's syndrome is related to a B1 deficiency, and it's a triad of neurological signs and symptoms that is often a precursor to Korsakoff's, which is long-term cognitive changes from B1 deficiency. So you can put somebody into Wernicke's by giving them just glucose if they're hypoglycemic. And they're thiamine deficient. So you give them thiamine with it. And I've actually consulted on a hospital ED case where the physician did not do that. The woman who was the patient had a really bad outcome, and the hospital asked me to consult on whether I thought they were at fault. I said, yeah, you're at fault. So they may have said, I don't know what happened with it. It's sort of a real no-no to give dextrose to somebody who's B1 deficient without B1. Without
Oh, okay.
finding.
How does it fix the ketoacidosis though?
The ketoacidosis responds to the dextrose.
Oh, okay. I thought also to the B1 by somehow elevating like this NAD levels in the liver or so.
I don't think so.
Okay.
I don't know.
It's just to make the
The whole
dextrose.
point of the ketoacidosis is there's hypoglycemia. People in alcohol withdrawal, for example, are often have low blood sugar levels, and so they're burning ketones for energy. It's not unlike diabetes, where you get ketoacidosis for the opposite reason, because they can't utilize the glucose, so they're burning ketones, even though there's plenty of glucose around.
Yeah. So yeah, I read into it a little bit, and there are some animal models that show that if you just have a very poor diet, plus you expose an animal to a lot of alcohol, then you have very similar, so you basically induce alcoholic ketoacidosis, but nobody has studied it with the ketogenic diet yet. And but they did replicate that a ketogenic diet alone would never lead to alcoholic ketoacidosis. But it may very well be that a ketogenic diet plus high levels of alcohol lead to a similar phenomenon.
So starvation or undernutrition in this country is uncommon. Overnutrition is much more common. The group with undernutrition are people with alcohol use disorder, because they're getting so many of their calories from alcohol, and they also have gastric irritation from alcohol. So they eat less and they consume less B1.
Yeah.
And other minerals and vitamins.
Do you still have a question, right? Or was it answered? Okay. Yeah, so we wanted to proceed with maybe an outpatient ketogenic diet intervention to see if in outpatients also decrease alcohol consumption, but we really first need to see what the effects of a ketogenic diet on alcohol metabolism is in healthy humans to be able to do this, because we don't want people or to harm people.
Are there, or have you worked with people who conducted studies in metabolic cell assays in vitro to look at, or has it already been well established?
I don't think so.
Oh, okay.
Or what is the experiment that you would want to do?
In like a cell,
More at a cellular level?
yeah, like at a, cell-based assay where you, I wouldn't know how to do it, but but when you look at the effect of ketones on certain cell types or tissue types, and then try to get a proof of concept.
Yeah. I mean, I don't think it has been done. There's really little out on ketones and alcohol. So that this ketogenic diet intervention was the first study in humans. And if anything that was done is all about this directionality, namely where the ketones are actually more the outcome or the byproduct of a clinical condition. But we don't know whether in giving ketones actually would induce this. I remember when we tried to start this study, many clinicians at NIH and the ethical board like, oh no, you can't give ketones to people who are detoxing with alcohol because then immediately they will go into ketoacidosis. Well, it really wasn't the case, but we definitely had to wait for people to first, that they were not intoxicated anymore before starting a ketogenic diet. But for the ketone supplement, I'm definitely less worried because of that strong effect we saw on alcohol levels. Namely, if alcohol doesn't get absorbed, it may actually be quite protective for people to combine this ketone supplement with alcohol.
Or they may drink more to get the desired effect.
Yeah, we don't know. It could be. So we've only tried with one small.
Because when you look at smokers
Uh-huh.
and you give them nicotine-free cigarettes or very low nicotine cigarettes, or particularly the kinds of cigarettes that there are holes punched in around the periphery of the cigarette so that they get more oxygen and less pull on the smoke, on the tobacco. So they end up even unwittingly covering up the holes so that they can get more of a draw.
Huh.
So yeah, people behaviorally accommodate to.
Yeah, so we only tested one dose of alcohol, but now we want to see if
That's
you
a pretty
increase.
dramatic effect.
So Cindy, what is the target that you 0.1%, right?
We were targeting 0.08.
Oh yeah, 0.08. That's probably a good start. So Cindy will run an experiment where healthy people will undergo 3 different conditions. One, a 3-day ketogenic diet, a 3-day regular diet, and then a 3-day regular diet in which for breakfast, lunch, and dinner they additionally receive this ketone supplement, and then undergo this same paradigm, but with much higher levels of alcohol. So then we can distinguish what does the ketogenic diet do, what does the ketone supplement
This
do.
is going to be inpatient.
No, it will just be here.
Oh.
It will just be here in the other conference room.
Oh, good.
We'll call you if we need you.
Hey, why don't you give me a little advance notice, okay?
So never give dextrose without D1. Huh? That's
Oh, yeah, yeah. I mean, you give dextrose intravenous.
okay.
You know, it's D5W,
Okay.
dextrose 5% water.
Well, we still, so in the rats, we saw the effect after, was it a 6-week ketogenic diet? And here, 3 days is not going to do that much, but well,
No, but the
We'll
high
find
levels of
out.
alcohol,
okay.
Yeah.
That is more
that was
concerning.
more concerning.
Do you think we should slow down for a first study?
I don't, do you have IRB approval for that?
We just
Submit it?
we submitted it. We just wanted to resubmit it. Should we send you the protocol again? I think we've sent it before, but one of those ketone protocols.
Yeah.
But anyway, conclusion, future directions. Ketones may be of therapeutic benefit to individuals with AUD by improving brain energetics and or many other mechanisms that we don't quite understand yet. For the ketone supplement, we really need to find a good optimal dose, and we're working with different products, namely many of them are really not palatable. So this delta G that we started off with for the imaging experiments is extremely bitter, and some people were gagging drinking it. This kinetic is a bit better, but there was also one person who vomited out of 12 who didn't want to do the second study. So yeah, to actually have people take this on a regular basis is going to be challenging. But if we foresee, we also gave a lot of it in one dose. If we can see like, okay, well actually half of this or a third of this would already lead to the desirable effects, and of course that may be helpful. And we need more studies on the effects of ketones on alcohol consumption and craving in humans, but again, with caution, with hand close by. So many thanks to.
May I just ask you a question about kinetics? What is it marketed for?
For physical endurance,
Okay,
but it's a nutritional supplement. So I think, yeah, so it's
Yeah.
marketed for physical
Yeah.
endurance, but they're on the phone almost every other week to ask when we publish this paper, so they can also add it to their website.
oh, yeah, that it reduces alcohol levels?
Yeah,
Oh, yeah.
and they're also like, didn't we come up with that idea? So no, you did not. They wanted to patent it.
Well, they may, you have to be careful. Once you publish it, you can no longer patent.
Oh yeah?
Yeah, if you want to patent it, now's the time to do it.
Yeah, we already did it by them expressing interest. So we contacted the patent office, like, how does this work? And Ben was laughing, like, no, that's not their invention. This is your data. You can't just give it to them. So I said, oh, okay, it's good to know. So we submitted it.
Did they
weeks ago.
submit a pending application?
Yeah.
Oh, so you have a patent pending?
Yes. But I'm not sure how helpful that is for us, because now for every paper, you suddenly have a conflict of interest.
No, I have, it could end up being valuable to you personally and to your lab, because you get a portion of profits. If it gets licensed, that's the whole thing. There's nothing inherently valuable about a patent. It's only when it's licensed that you get revenue from it.
Okay, so it may actually not be a bad idea to just give it away to, I mean,
I wouldn't give it away.
no,
No, I wouldn't give this one away.
okay.
They would license yours if they really want to. No?
Oh, and then
The company can license it.
the company can license it, and then Penn gets 99%, and Cindy and I
No,
get
that's not true.
%. No,
That's not
okay.
true. No. Penn gets most of it, but not, I think it's like 60-40.
Okay,
I don't remember well, I don't remember because our patent has never been licensed.
oh, okay.
So it's just not
So then you only have the trouble and not the.
exactly.
I see. Oh, but I just submitted the conflict of
Is
interest.
that Rachel?
Yes,
Oh my God, I barely recognized,
also before she started at Penn.
barely recognized her. And Claudia looks so contemplative.
All right,
And Jen Howe, that doesn't look like Jen Howe either.
maybe I need to update
I
our,
think you do.
our pictures a little bit. All right, well, thank you so much. Let me know if you have any questions. I don't know. Or if anybody wants to participate in the Cindy's new research study as a healthy volunteer. Yeah,
In terms
Can't
of
have
the-
students.
In terms of the
Oh, sorry.
withdrawal, is the keto diet being used like in hospitals or in inpatient facilities?
not for alcohol withdrawal yet, no. So it was really the first study that we did, and we published it 2 years ago, and I don't think clinically it's going to fly well because it's so hard for people to stick to. So it's much easier to give the benzos.
Yeah.
But I was still surprised that people still rated it as like a 6 or so. But many people also believe whoever signs up for a study like that also wants to believe in it and wants it to do something. So
I mean, can it just then be applied more for like inpatient use rather than outpatient?
yes, I think outpatient may almost be impossible. We visited an epilepsy clinic where people received a ketogenic diet and they were on it for years, and there they were sticking to a 1-to-1 diet throughout their life. It was very interesting also to speak with people who said, yeah, okay, I was seizure free, and then after 5 years of being on this diet, I just wanted to have a bite of chocolate, and immediately this patient actually had a seizure again. So, but for epilepsy, people are really motivated to stay on it because it's so severe if you're not. And it doesn't work for everybody, but it's maybe 10% or so of people who do not respond well to the first lines of epilepsy treatment. But for AUD, I cannot imagine people sticking to a diet like that.
For AUD, it would be in combination with the medication, right? Or
For withdrawal, absolutely, yes. Yeah, for severe withdrawal.
I have a question. Where's Juliana's picture?
Oh, actually, Juliana never gave me a picture.
Oh,
I think previously I just downloaded one from the web, but I never received consent from her. Yeah, so Juliana was our coordinator for the last 2 years, but she just left for medical school. She was awesome. She ran 5 protocols or so at the same time.
Is she like a Penn? Is she my classmate?
Yeah.
No,
no,
she went
she's
to
a first year
Chicago.
at the University of Chicago.
But in terms of withdrawal management, I think those ketone supplements may be more interesting if they work.
I think the ketone supplement looks like it could be marketed. I'm not, there are concerns that would be raised, but as a way of reducing people's blood alcohol level when they drink.
Yes. Or why is that a concern?
Well, because what happens if they drink more to overcome it? I mean, you run, so alcohol has effects other than intoxication.
Mhm.
It's an irritant, and it causes, liver disease, it causes gastrointestinal, GI distress. I mean, it causes a number of problems independent of the intoxicating effects.
So you mean more if it blocks the absorption, where does it stay, and does it then
No.
irritate?
If it if it blocks the absorption, it's still in the body. It's still in the GI tract. Could cause GI problems, even when it's not absorbed. It may not be liver problems because it's not absorbed, but it could be small bowel problems or large bowel problems.
Okay. And does alcohol eventually get broken down somehow if it just stays and doesn't get absorbed?
It probably is excreted.
Okay.
So you should probably measure urinary alcohol levels.
Yeah, and well, we definitely need to do a dose response to see, okay, if you increase the dose of alcohol, does this still work? And also if we decrease the dose of
And
ketones.
if you give people free access and you block absorption, what does it do to their consumption, their self-administration?
Yeah.
You can do that in an animal. So.
Is there a way to measure excreted ethanol because it evaporates
Yeah,
In the
breath
feathers.
alcohol.
in urine? Is it possible
You can measure urine.
in humans?
Oh, yeah. Absolutely.
But especially with a 0.08 dose.
Oh, you should definitely measure urinary alcohol level.
Okay, let's add it.
Would it be excreted in the urine without first passing through the liver?
Some of it is going to be.
Oh, yeah.
It doesn't completely block. Doesn't completely block absorption. Reduces absorption. And so you'll have lower levels in urine. I mean, ideally, you probably want to get fecal levels.
Yes, take a stool sample and then nobody wants to participate anymore.
Yeah, exactly.
And finger sticks and the horrible drink and a stool sample. But the reverse experiment would also be really interesting, that you first give alcohol and then it takes about 15 minutes for alcohol to be absorbed and then ketones. Does it still reduce
It's
it?
longer than 15.
Oh, yeah?
Yeah, I mean, peak absorption is 40 minutes. And it's because peak absorption occurs through the proximal small bowel, not the stomach.
Yeah, we have a meeting next week with Leandro. See, somebody has 21 new animals that he can do whatever he wants with. So he will look at gastric emptying. He will look at also the difference between all those ketone precursors to compare them. And what else do we want to do? Well, that's Bill.
Maybe people and rats.
People and
Yeah.
rats.
Urinary and fecal. I don't know how they collect. Might be difficult to collect urine samples.
You could take like the bedding, I guess.
What's that?
Maybe take it soon enough, like the urinated bedding.
Bedding.
There's like a metabolic cage, so it has a tunnel. So like the urine will go through a tunnel.
Yeah, it's not going to be, I don't want to get into too much detail, but it's not going to be separate compartments. I mean, it's all going to be mixed together.
Yeah, but then you want to actually then have urine separate from.
Yeah, because exactly. Yeah, because one's going to reflect the absorbed alcohol and the other is going to reflect the non-absorbed.
We'll find out.
There are people that know how to do metabolic studies much better than I do.
Yeah, we should probably find some collaborators with Penn too.
Somebody in GI.
All right. Well, thank you so much.
Thank you.